Today we'll see one new topic, that is complex regional pain syndrome. Complex regional pain syndrome, shortly CRPS, is a perplexing medical condition, like confusing medical condition, characterized by spontaneous evoked regional pain and usually begins in a distal extremity. CRPS begins when a patient has an injury to a nerve, bone, soft tissue, or connective tissue, and there may be swelling, tenderness of the finger joint, and some vasomotor changes will be seen. CRPS has two classifications, CRPS 1, CRPS 2. CRPS 1 replaces sympathetic dystrophy, which one minor nerve injury or fracture. CRPS 2 is causal here, develops after injury to a major peripheral. Coming to incidence and prevalence of CRPS. CRPS is rare. Even with fracture, the most common inciting event, only 1% of patients develop CRPS. CRPS 1 is higher than the CRPS 2. Mainly, the lower extremity is affected more than upper extremity, and female, adult age, postmenopausal status, smoking are all a risk factor. In the pediatric population, the incidence of CRPS increases. Next, coming to pathogenesis of CRPS. Till I told before, like pathogenesis is a confusing medical condition. Like it is till now the pathogenesis is unclear. Still, in one study, it was recognized that multiple mechanisms are involved: abnormal cytokine release, neurogenic inflammation, sympathetic mediated enhancement of pain response, and as yet poorly understand cortical reaction to noxious stimuli. Now we'll see clinical features of CRPS. As I told before, the some vasomotor changes we'll see here, like patients complaints of burning pain, cold intolerance in the affected area, usually in the hand or foot. In the mild or early cases, slight swelling with tenderness, stiffness of the nearby joint. Symptoms may start distally, progress steadily up the limb to involve an entire quadrant of the body, and the patient will get hyperesthesia or allodynia at the site of injury. Okay, so these are the features we'll see. In this picture, we can see a 53-year-old woman suffered an undisplaced fracture of her right tibia and diagnosed with a complex regional pain syndrome, and features with like swelling, warm to the touch, and the skin reddish purple and sweaty. So these are the features here where stages of CRPS. There are three stages of CRPS. First stage is severe pain and inflammatory sign. Second one is marked by more intense pain, brownie, edema, pallor, rigidness, osteoporosis. Stage 3 is unyielding pain and irreversible skin and bone change. Some of the differential diagnosis of CRPS is cellulitis, lymphedema, stress fracture, acute synovitis, septic arthritis, deep venous thrombosis. These are the differential. Next, you will say treatment of the CRPS. In mild cases, some of the anti-inflammatory drug we can give, and physiotherapy, occupational therapy can provide. So, other conservative measures include the administration of corticosteroid, calcium regulating drugs such as calcitonin and biphosphonate, and tricyclic antidepressant. Okay, and some of the modalities, therapeutic modalities also we can provide. Now we'll see what is the occupational therapy role in CRPS. Okay. First is therapeutic modalities like hot pack and cold pack. Next, we'll provide like as a therapeutic tool for relief pain. In amputee case, mirror therapy we can give. Mirror therapy, it will be useful for visual feedback, providing active assist to promote and to improve movement. And the next one is restore functional ability, independence, and improve their well-being and quality of life. Sensory exercise to improve the processing of pain triggering processual stimuli in early stage. And prism adaptation is a behavioral intervention targeted at reducing attention deficit in post-stroke hemispatial neglect.